Okay.
Yeah, I'll be recording through the whole time, so you don't have to ask me if I'm still recording.
Okay. Great.
Great. Can you first start by introducing yourself?
So hi, I'm Suzie Bertisch. I'm a sleep physician and researcher at Brigham and Women's Hospital and the clinical director of behavioral sleep medicine.
Fantastic.
Also, 1 second. When she asks the question, give it like a few seconds before you answer.
Okay.
So you don't hear her in between
Okay.
it. And when she's finished, give her a second.
A
and
second.
Then you can
Okay.
ask again.
Okay. So, what is insomnia?
So insomnia is a clinical... yeah.
It's okay, the sound also.
Yeah.
So.
That's fine.
Insomnia is a chronic medical disorder characterized difficulty falling asleep, staying asleep, or early morning awakenings that occur at least 3 nights a week and have lasted for at least 3 months. And importantly, it not only presents as sleep problems, but it needs to cause impairment in daytime functions such as difficulty with concentration, difficulty fulfilling roles at work or in the context of one's life. And the last part of insomnia is that it can't be explained by other sleep disorders. So if your sleep disturbance is due to another sleep disorder such as sleep apnea, or a patient has severe anxiety that's keeping them awake at night, typically that doesn't fall within the diagnostic criteria of insomnia.
How do you approach the treatment of a patient with insomnia?
So there are several, I forgot to repeat it. I'll get used to it.
Okay.
So the 2 main strategies we use to treat, I'll start again. So when we think about treating insomnia, we think about 2 main ways to treat insomnia. So one is using pharmaceutical treatments or prescription drug therapies, and the other is using behavioral treatments of insomnia. And they're thought that the behavioral treatments work as well as the pharmaceutical treatments and have fewer side effects.
Great. If a
I didn't know if you wanted more detail on behavioral.
Yeah.
Okay. We can get into that, but I didn't, that could be like a 5-minute answer, so yeah.
Sounds good. We also interviewed Eric, so he also
Oh
chatted a
yeah,
lot about...
Eric's actually a friend of mine. Yeah,
Yeah,
I
he's
should
great.
have conferred with him before. He's like perfect for this thing. I think he's like the media person.
Both of you
yeah.
guys are.
Yeah.
Okay. If a person believes that he or she may have insomnia, what steps should the individual take to get evaluated?
So if a person thinks they have insomnia, the first way to get evaluated is to talk to your physician, so your primary care physician, and to let them know that you're experiencing difficulty with your sleep that's making it hard for you to function or impacting your mood on a regular basis. Many times people with insomnia suffer alone and they don't think it's either important enough or something that their doctor is interested hearing about. So it's really important to let your physician know, particularly as insomnia is not routinely screened about during your visits. And most importantly, because we actually have effective treatments to treat insomnia. There's no reason to suffer alone.
That's great. How does insomnia impact the individual and society as a whole?
So patients with insomnia, by definition, it needs to interfere with their daily life. So this can be distress about not sleeping well at night, not feeling like your sleep is restorative. We know that poor sleep impacts next day mood. It can impact next day pain, and it can just make it difficult to, be able to perform, other things throughout your life, having less patience, having difficulty concentrating. It really impacts how you feel on a daily basis. As far as the societal impacts, we know that insomnia is very common. About 1 in 3 Americans report insomnia symptoms, which is different from insomnia disorder, but we think that 10 to 15% of adults in the United States suffer from chronic insomnia. So it has a huge burden in terms of how it makes people feel, the impact of poor sleep on health, and then we also know it causes higher rates of absenteeism at work and even higher rates of accidents.
What is the relationship between insomnia?
I was just going to say, the one thing I forgot to mention, it's also, I'll just pause.
Mm-hmm.
And insomnia is also a risk factor for depression, cardiovascular disease, and early death.
Great. So going back to that, what is the relationship between an insomnia and depression?
So insomnia, depression is a chicken or the egg. We know that a lot of people with depression report problems, difficulty sleeping, and have insomnia symptoms. And we also know that insomnia symptoms can also lead to depression. So they have done studies where they follow people with insomnia and over several years find that compared to people without insomnia, people with insomnia have higher rates of developing a major mood disorder such as major depressive disorder. There's also some evidence to show that when we treat insomnia with behavioral treatments, we have seen some signal that this not only improves sleep, but also can improve mood. So that gives us further evidence that it's not just poorly sleeping due to the depression, but that the sleep is thought to be contributing to depression as well. Is that clear? It's sort of like a circular
You
reasoning.
can do like the last half again. Just
Okay,
to
yeah, I
add-
kind of
just
tripped
in
up on the
case,
words. Yeah, I don't. What was the last half about the treating it?
Mm-hmm.
We also know that in patients with depression, treating their insomnia with behavioral treatment seems to improve their mood disorders, and that just gives us further evidence that it's not just depression causing insomnia, but that insomnia can cause depression.
Good.
Is that better?
Yeah.
Okay. I think I'm being pretty simple, right? I'm trying
You
not to
are.
be that
It's very
jargony.
simple.
Okay.
I understand.
It's
Okay,
perfect.
okay.
I'm-
You're doing
There was
great.
one thing that was like a little bit, I wish I didn't say that earlier, but I can't remember what it was.
I
can't
thought it
remember
was
what it
very
was.
clear.
Oh, I think it was the general anxiety disorder because Eric's mentor I know would be like, but people with, you can still treat the insomnia even in anxiety. So that was the
I
one
see.
thing. But
You can do
Eric
it
probably,
over if you want.
Eric probably also gave you that answer too, though.
He
did
did,
he? So,
yeah.
okay, you might want to just use his instead. Yeah.
No
Yeah.
problem.
But I think there's enough other messaging that even in the context of it, these other disorders, you can still be treated.
People
So.
yeah, I think
Yeah.
so. How has technology impacted our sleeping behaviors?
So in general, technology, so broadly defined as, living, well, can I say, do you mean just like cell phones and stuff or
Generally,
just like lighting, like the advent of electricity?
so in this scenario,
Or
I should have
technology.
specified, but technology as in like phones and devices,
Okay.
not light therapy
Okay.
and whatnot.
Oh, yeah. Okay. So what we see a lot of now in our clinic is people having difficulty sleeping. And one of the things we always ask about is, are you using your phone or your electronic device at night? We know that the light from the device can cause, it can interfere with the body's typical biological rhythm or the circadian rhythm. It may make it harder to fall asleep at night, not just through the light though, but also just due to the stimulation it provides. So it is something that we commonly see to be potentially disruptive to sleep. And it's also people avoid it. They stay up late at night, they're on their phone for longer than usual, and it's sort of a robber of sleep as well.
Great. Let's see. What healthy sleep hygiene or practices do you encourage patients to implement daily?
So in terms of sleep hygiene, I'm really happy you asked that question. So as someone who treats people with insomnia, unfortunately, sleep hygiene is important to do on a daily basis, but it's typically not an effective treatment for insomnia. So this is a common myth we see all the time with patients. They come to our clinic and say they've tried everything for their insomnia because all humans sleep. So we're all experts about sleep because what works for us will work for other people. But unfortunately, people who actually have real insomnia disorder and not just some problem sleeping, these healthy sleep practices will only get them so far. I'll pause. So healthy sleep practices are things that are important to do at night or things that help sleep. So the body loves routines. We are animals, and by nature, we need to have a certain pattern to our sleeping. So waking up at the same time every day, getting exposed to light at the same time is really important to maintain that rhythm. Physical activity also is very important, and it helps improve quality of sleep. And it doesn't matter too much, what time, as long as you get physical activity. And some people, if they exercise close to bed, it may disrupt people, but in fact, it's probably not as common. So we advocate for just getting physical activity at any time of day. staying off electronic devices, and keeping your sleep environment cool, dark, and quiet are all things that we advocate. And lastly, we also tell patients as much as they can, don't spend too much extra time in bed. Keep your bed as sort of a sacred place for sleep as much as you're able to. And then not only there are things we can also do to help sleep, but then there's also things we tell people to avoid interfering with sleep. So drinking caffeine later in the day will make it harder to sleep at night. Drinking alcohol, though that often helps people fall asleep, it does fragment sleep, so we discourage that. And in order to achieve healthy sleep, we tell people to, try to have a bedtime routine to help them go to sleep at night. So again, the body likes a wind down period. Try to de-stress yourself as much as possible to help with sleep at night. Are all things that we tell people to do or to avoid to maintain healthy sleep. There's probably like one thing I forgot, but whatever.
No,
They can find on the internet.
It doesn't have to be
I try to
exhaustive.
dispel some of the myths, so yeah, which maybe was a little too wordy, but
No, that was good.
yeah.
What medications do patients with insomnia typically take?
So we know from some of our research that patients with sleeping problems do take medications, and nearly 1 in 5 adults in the United States use some sleeping pill to help them sleep better. The vast majority of those are over-the-counter medications that you can find at local pharmacies. Unfortunately, those have not been studied very much as far as for treatment of insomnia, plus there are potential known side effects of those medications. As far as prescription medications, there are several FDA-approved medications for sleep, the most common one being Zolpidem. And there's also some other medications that have been developed and are FDA approved. The most common off-label medication, so where it's not approved by the FDA, is something called trazodone. So those are the 2 most commonly used medications in the United States. There's also a list of like 5 other FDA medications that nobody knows, but I didn't know if you wanted me to go through all of their names.
I think the most common.
Those are the 2 most common that are used, yeah.
And then also I liked it how you mentioned the over-the-counter as well.
Yeah. That's the way, so over-the-counter medications and alcohol are what most people use to treat insomnia. Yeah.
Speaking of alcohol,
Yeah.
what are the effects of alcohol on sleep and insomnia?
So we know from experimental studies, so these are studies where they bring patients into the lab, that alcohol helps people to fall asleep faster, but it does cause people to fragment sleep. And by that I mean it causes people to wake up for short periods during the night. And this is not necessary because alcohol, does make people go to the bathroom more, but it is disruptive to sleep. So it's common when treating insomnia. We encourage people not to drink alcohol close to bedtime because we know it we think it can contribute to ongoing insomnia.
What is cognitive behavioral therapy for insomnia?
It's a better question for Eric.
I did ask that. I asked both.
It's actually, yeah, it's fine.
You don't have to answer if you don't.
No, it's fine because I can answer the question. He actually does it. I don't do that, but yeah. So cognitive behavioral therapy for insomnia is a cognitive and behavioral, and I want to emphasize the behavioral treatment that focuses on setting rules and boundaries and patterns around sleep in order to treat insomnia. It's typically comprised of 5 different elements. So one is, healthy sleep practices or sleep hygiene. The other is focusing on having people spend less time in bed, which is very counterintuitive. The third is removing things from the environment that people associate with staying awake. So this is often called stimulus control. The fourth component is helping people learn relaxation techniques such as deep breathing exercises or progressive muscle relaxation to help them fall asleep at night. And the fifth part is cognitive therapy. So there's only one part of the component that focuses on cognitive therapy that's supposed to help people overcome some of the mental barriers they have about attaining a good night's sleep. Cognitive behavioral therapy for insomnia, also known as CBTI, is considered first-line treatment of insomnia by several major guidelines.
Yep.
Yeah.
I think does the AASM recommend it? Or?
Well, it's funny because like the ASAM actually doesn't have a guideline where they say one or the other. They have a separate guideline for medications and behavioral treatments. So they actually, but they do recommend CBTI as like the most evidence-based. It's the American College of Physicians, which I was like sort of stumbled because I didn't want to say American College of Physicians, but yeah.
No problem.
Yeah.
Alrighty.
And my speaking kind of weird when I'm giving the answers. I feel like it's a little contrived, but yeah.
No, it's
Okay.
good.
Yeah.
All right. What can a patient with insomnia expect in a meeting with a sleep physician?
So when patients with insomnia come to evaluation to see a sleep physician, at the very first visit, the first thing we do is what we do throughout our medical training is to do a differential diagnosis. So we obtain an in-depth history, not only of their sleep and activities throughout the day, not just in the night, as well as their health habits and medical history and medication use. But we also try to figure out, is their sleep problem due to insomnia or is it due to something else, such as another sleep disorder, another medical disorder, a psychiatric disorder, overuse of a certain medication, prescription medication, or over-the-counter substance. So the first visit is really spent pinning down what is the diagnosis and whether or not the person has insomnia. Once the diagnosis of insomnia is made, then we really talk about treatment of insomnia.
Great. What has the impact of treatment been like for your patients with insomnia?
So treatment of insomnia can have a wide range of impact on patients depending on their response. So I think what's really great about having, so many evidence-based treatment is that we're able to treat most patients. So that doesn't mean that everyone becomes perfect sleepers, and we tell patients it's rare that you'll make the Olympic sleep team after that. But our goal is really to improve their sleep so much that it no longer impacts how they function during the day. And we have many effective behavioral treatments, such as cognitive behavioral therapy for insomnia, which is available not only through face-to-face or telehealth, but also evidence-based web-based applications that people can use. And when you treat people with insomnia and they have a great response, it really changes their life. They'll tell you that they feel differently, they act differently, they can function, they just sleep so much better, and it can have a profound impact on their treatment, not just their quality of life, but also their mood, and potentially, to be seen in studies, other positive health outcomes. Some other patients may have a more variable effect, and so we're frequently seeing patients back in clinic to really try to optimize their sleep as much as possible. But most patients, the majority of our patients, do have some positive response to treatment. Sometimes it can just take patients a while to find the proper road to treatment, as they often think that sleep hygiene is treatment for insomnia.
That makes sense. So speaking more about quality of life, how might the quality of life for the patient and their bed partner be impacted by treating their insomnia?
So we know from many clinical studies that treating insomnia for the average person will improve their quality of life. There's less information about bed partners. Often insomnia can impact the bed partner. We often see patients who get up and move to another room or opposite of their bed partners are actually sleeping in separate rooms for their bed partners. So that's the one thing. I actually don't know the literature as well as I should for like bed partners that Wendy Troxel studies.
No
So
problem.
yeah, Eric probably does. So yeah.
If a patient has successfully been treated for their insomnia, what things should they do to prevent a relapse?
So people who have overcome insomnia, it's still important to know that they may have an underlying predisposition.
We can do it over. Not a big
Yeah.
deal.
I was just gonna pause. Can I just go back to predisposition? Okay.
Just do the whole thing, because it was so short.
Okay. If I can remember what I said.
I can ask the question
I think I
again.
remember what I said. Yeah.
I can ask the question again.
I know. Yeah. So for people who've overcome insomnia, it's important for them to know that to prevent it from.
It's okay.
That's fine. Yeah. So for people who've overcome insomnia, it's still important for them to know that they have an underlying predisposition to insomnia, which means they potentially can develop it again. And sometimes we do see insomnia come and go. It is, at times a chronic disorder. So it's important to, maintain some healthy routines, depending on the treatment approach they used. If they use cognitive behavioral therapy for insomnia, it doesn't mean they need to go back right away and necessarily do all the elements before, but really sticking to the basis as far as listening to their body, going to bed when sleepy, maintaining routines, and really hone up on those healthy sleep practices. It's also important to recognize that if you're doing all the right things, just like the initial time of diagnosis, if you're still having sleep complaints, you certainly can go back and get treatment before.
Great. So those are all the questions that I have prepared, but
Okay.
did you have any additional pearls of advice you wanted to share?
No, I think I kind of snuck them in, like not so subtly here and there, like talk to your doctor. Just because you've tried everything, you haven't done it. Trying to think. I said something about the web-based CBTI, which I thought was important. I didn't talk too much about meds and side effects, but I feel like that could get kind of complicated in terms of
I created a chart with all of them, so I think that nice introduction that you gave to the medications was a good way to kind of start off that section.
Yeah. Because they don't need to. Most patients don't really care what all the meds are. They just want a medication that's good. I mean, unfortunately, the meds are only like so good, and they all have side effects. That's the other thing.
Mm-hmm.
I mean, maybe something about like interactions with alcohol and side effects, but I feel like if anyone's getting a medication, they have to talk to a prescriber about it. So I don't think it's important. I don't think this level of awareness, you need to talk about it. I think that's the only other thing that comes to mind.
Great.
Yeah.
Then
All
I
right.
think we're good.
Yeah.